Pete, welcome. It's very nice to talk again to someone from Australia. I usually have at least one guest from Australia per year, and it's always super interesting to hear their perspective on My Health Record, which for those that might not be familiar with, is basically the system for storing electronic healthcare record across Australia. Currently, 23.3 million people in Australia have My Health Record. And just to clarify, Australia has close to 26 million people. The big majority of people has their own health record on the platform. And there's been a lot of controversy happening around My Health Record in the past. First, it was an opt-in system. Then clearly the statistics didn't go up in terms of how many people actually applied for that, so it's turned into an opt-out system. And then the critique that I actually got last year was that because not all health providers are adjusted or have the connectivity to be able to connect to the record, in the end the records are incomplete and the system becomes unjust because it only serves a certain population of people and not the other part of people. So how do you see My Health Record? What has been progress in the last 2 years according to your observations?
My Health Record is an interesting one because, like you said, there was a really good explanation, and thank you for providing that, because it's something that existed for quite a while, and there wasn't a great deal of interest from the public in having a central health record for every Australian, and the typical kind of justification or use case, this is 10 years ago, I think, was, hey, if you're in an ambulance and you're unconscious, then the paramedic could look at your My Health Record and then see what medications you were allergic to, and then that way they could administer, and people are like, okay, that sounds interesting. But then obviously that relies on a lot of information to be loaded up into the record, that relies on the person actually setting it up. And that whole process was a really difficult one from an end user perspective. And it just, once you are actually in the My Health Record, this was the ongoing joke that we had within the industry. What do you actually do with it? And I see one blood test perhaps that a provider had loaded up 6 months ago, and it's the PDF, but it takes 15 clicks to get into it. It's great. And now I've got the PDF. It's not actually data that's in a field that you could do anything with. And it's okay, that's great. But then it just went under the radar, and I thought, this is a real kind of missed opportunity. A lot of investment went into My Health Record. But then at that point where you said that there was went from opt-in to opt-out, everyone was just given a My Health Record. That was also okay for a while, but then I think there was a lot of media that then brought up this issue of what's the government going to do with your health information, and you should have a right to opt out. And so that created this big political kind of football that was being thrown around. I think that derailed a lot of the conversation, I think, but also brought up some interesting points around data security and privacy, which are all relevant too. So that became an issue, and quite a few people opted out of having a My Health Record. Although that whole sentiment died down a little bit as the dust settled, then I think the next time that My Health Record had a real big focus again was obviously around COVID, and as vaccines were administered and everyone needed to be able to show proof of vaccine to be able to go out and do things again. My Health Record was used as the place of reference for your vaccine certificate. So that's where you see there's been this huge uptick in terms of people using the My Health Record, because there's actually a reason to use it now. That's where your vaccine certificate is, and it's a bit more than clicking on a PDF. You don't open up a little PDF and zoom up to it and all of this. It's actually it's an okay user experience where it gives you a little green tick at the top and you open your app and that's where it is. So I think that's demonstrated that if there's a reason to use it, and it's a decent enough experience, then the thing's going to get used. I think the challenge will be for us now actually investing in more use cases that more of the public would actually see benefit and interest in. I don't think every Australian's interested in seeing their routine blood tests or their routine x-rays or anything like that. But I think that if there was a way to be able to utilize that as a platform to have your core bits of information, then potentially there's some good use cases. There's a whole other story about incentivizing providers to actually load information up to it, but I'm going to pause there for a second.
Oh, but that just sounded like it's going to become interesting. Just a quick comment there. I think that we see in a lot of other countries. To me, it's very interesting to listen to presentations about the state of healthcare digitalization across the world, because when you hear that a country, especially in Europe, where you have smaller countries and it's easier to have some sort of a national backbone system, and when somebody says that EHRs or personal health care records have been in place for years, and some countries really do have a long history of that, that information says very little. When you start digging deeper, you realize that it's exactly the situation as you described. So patients get their PDFs from their medical visits there. So very unpractical to search information from. And again, same challenges. Providers don't put the information on the backbone.
Yeah, and I think there are some incentives in a way for clinicians to load up information into My Health Record, but practice management systems here in Australia, which are like the EMRs for the GP clinics, they have done their best with the infrastructure they've got to be able to allow a one-click upload and all of this. But there's a lot of stuff that it falls back onto the GP to do, and if the GP doesn't get paid appropriately for it, they're not going to do it. And also, if it's reliant on that extra step, so another bit in the workflow that a clinician needs to load something up, of course, from a patient side, you're not going to get a full picture of your health unless you're going to the one clinician all the time who's really diligent and proactive about loading stuff up into your My Health Record. You're only going to get little snippets from it. So there are many technology providers around Australia who are building adjuncts to the My Health Record, or even just something totally different and siloed, which is a bit of a shame when, like you say, we've got the potential to be able to, like the vision sounds like at one point was to have this backbone and infrastructure to be able to then build on top of. But there is very rarely any building on top of the My Health Record because it's just not seen as a good infrastructure to build on top of yet. So yeah, it's
I one word that you said is really important, and that's yet. So you think it's gonna just develop over time? Because we do have to be fair that on top of the fact that things happen super slowly in healthcare, these things take time for adoption to come in, for improvements to come in, etc., etc.
I'm optimistic, yes. Definitely. And I think we have to be. And I think all together it's a role that I have seen the Australian Digital Health Agency, which is, our agency responsible for, I guess, everything to do with technology and digital in healthcare and policy and stuff around that, and responsible for the My Health Record. There has been a lot of consultation recently with industry and stakeholders, so not just vendors, but clinicians and patients as well, about what they want, not only what they want in terms of the information out of My Health Record specifically, but also how healthcare should be delivered. So with telehealth now being covered under the MBS, the Medicare Benefit Scheme here in Australia, so a lot of it is covered under Medicare. Although it's like everything, when you dig into it, that's a great kind of leading front line, but then you dig into it just like one layer. It's if you've seen the patient in the past 12 months and if you've done this and blah, 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 blah. So there's always the caveats around it which don't make it true telehealth is all available. But we're a step closer, and much like with the My Health Record, we've demonstrated that it was useful for the COVID vaccine proof of vaccination. So like the what next. And we did also see other states build their own apps. So here in Australia, we've got different states around the country, and I'm based in New South Wales. So we have our own New South Wales app that we use to do your check-ins and do all the other bits and pieces. But then also it's pulling from My Health Record to show your vaccine certificate too. So yeah, there's little pockets of optimism there. It took a pandemic to be able to force us down the line of doing something with it, but hopefully now we can use that as inspiration to do something more from.
The Australian government is actually investing $107 million Australian dollars to modernize the healthcare system in Australia. A large part of that is supposed to be for technological advancements. So I wonder, since Australia is a large country and we already described some of the challenges with healthcare digitalization, can you put this amount of 107 million Australian dollars into context for us? What can you actually get for such a large population? What are the expectations from the industry side or just the healthcare provider side?
It's a good question, isn't it? And I think it's always never enough. It's going to be, I think that it's promising to see that it's on the radar, and that's sometimes all we can ask for sometimes. And the devil's going to be in the detail and the execution of it. We're like in the midst of elections right about now. So a lot of promises do get made. So sometimes maybe I'm a bit jaded and older now that I feel that, so we'll see. But I think in terms of what we really need in Australia is that, like you mentioned, it's geographically, it's a very big country, but a lot of it in the middle you can't really live in because it's too hot and like dusty and stuff. So the healthcare challenges that we've had and the requirement for telehealth has existed long before COVID, and in rural and remote Australia, they were doing telehealth before it was cool, and because it was necessary for healthcare. There were some elements of Medicare, so some elements of healthcare were covered under Medicare when it comes to telehealth, but only for certain types of psychology services and liaising with specialists, but with a GP in the room. I don't think we need more technology per se around. I don't think we need more bits and pieces. I think we need more work on the current infrastructure and the interoperability of all of it to actually then do something meaningful with it. Our secure messaging in Australia, so the way we get results, so x-rays and pathology results into primary care, our secure messaging capability is, I guess, like other parts of the world, quite archaic, I'm going to say, because it's based on different providers, and it's really hard for a clinician to be able to set it all up so they can just get results, which is a really important thing. But don't even try to connect into hospitals and other parts of the healthcare system and more broadly, like aged care or disability, because as soon as patients start moving across outpatient and hospital and aged or disability, it's like everything starts again, or they bring a little bucket of paper with them from one thing to another. So in terms, I don't think we need new apps or new super innovative technology to solve that problem. I think looking at what we've got and start making it all connect together is going to be really important. So that's where I'd want to see some of that money go. And yeah, we need more of it.
Yeah. It's going to run out at some point. One thing that I keep wondering when it comes to technology, you need to keep updating the software. Subscription models are a thing. New solutions are available yearly, basically, for the unsolved issues. So to me, that almost sounds as if the costs for just the tech infrastructure and software is just gonna blow up at some point.
I think so. Yeah, it's funny, isn't it? I've spoken with different health services and hospital groups around Australia, and it depends where you are. There are some that are really keen on partnering with vendors and building in solutions and implementing technology to work behind the scenes. Yeah, bringing in more technology, but from a end user's perspective, from a clinician's or a patient's point of view, it doesn't feel like there's more complexity. What technology can we implement to do a lot of this work behind the scenes, whether it's AI to surface potential issues, but before people need to look for it themselves, or just being able to triage information or capture data. But I also know of a lot of health services here in Australia that are investing more and more to build their own apps and their own technology themselves. And I find that an interesting approach, where there are hospital groups which are almost turning into mini technology companies